Thank you so much for taking time to be with us today. Today, we have two experts with us. Uh, the introduction says they are oncologists. People like me will be wondering, what is this oncology? It's nothing but treating of cancer. And they're going to explain to us in detail. Today, we have Dr. Saro Jacob, consultant radiation oncologist and head of the Department of Oncology and Hematology Services in Baptist Hospital, Bangalore. Also, we have Dr. Vinu Sarathi, consultant medical oncologist. Thank you so much for joining us today. Welcome
Thank
to this Zoom platform.
Thank you. Thank you, sir. Thank you.
On 4th of February, it is observed as the World Cancer Day. Now, I don't know whether it is a celebration. There's nothing to celebrate. The moment we hear cancer, it's very depressing. Many of us have memories of our dear ones succumb to cancer. But why this World Cancer Day? What is the reason for this? What is the significance?
Yeah. Good afternoon.
Good afternoon.
That is a very interesting question you asked. Like, why are we celebrating World Cancer Day? And rather than celebrating, actually, till the year 2000, cancer was not getting much importance. In fact, most of the attention was focused towards hypertension, diabetes, and heart issues, which is when a few doctors they got together in Paris and decided to make cancer more important, and hence they sat down and at an international consortium decided to make February 4th as the World Cancer Day. And actually, this from 2019 to 2021, the motto is "I am and I will," which means I am aware of cancer, I am aware of the causative agents for cancer, and I will take the necessary precautions. And we can say we, as part of Bangalore Baptist Hospital, we are also enrolled under the same World Cancer Organization program, and we endorse the same. So rather than a celebration, this is more of an exercise to spread awareness, to make people more aware of cancer, that it is preventable and it is treatable in many cases too.
Now, people still have this doubt. What is cancer? It is not something that you can prevent with vaccine. It is something that is contagious like other infectious disease. So in a simple person's term, what is cancer?
Actually, some of those cancers are caused by viruses for which we do have vaccination. Cancer as such, every cell in our body is regulated or controlled by our biological system. Sometimes one cell goes rogue and it is no longer under control, or it is no longer regulated by our own biological system. It is like the cell has a mind of its own, and it controls, it divides uncontrollably, it proliferates, spreads to all parts of the body, and replaces the normal cells with the abnormal cell, and which can ultimately.
So if I ask you, you have a cell that doesn't abide by the rules of your body, it becomes cancer?
Exactly. Yes. It is a cell which originates from your own body, but unfortunately, it's no longer regulated or governed by your body rules, and that is what forms the cancer.
Okay. But why it is dangerous? That if you have a couple of cells like that, why it becomes life-threatening?
Actually, what happens every day, we are producing so many mutations, and we are producing such cells, which is under surveillance by immune system and gets killed every day. When the cell is lost by immune surveillance, they can go on sit in a niche and start uncontrollably proliferating, and can eventually wipe out their entire body and break your normal cells. Hence, it is dangerous. If you detect it early, you can remove the foci very early. But if it's detected late, it may have spread to too many areas, compromised the person's immune system so much that we may not be able to do anything.
Now, what is the cause of this cancer? People say so many things these days. So what is really behind this cancer?
Yeah, that is an interesting question, sir. Like, initially, nobody knew the cause of cancer. They used to say it is our whole body is governed by the vata, pitta, kapha, like that. But gradually, we have moved on. We have understood the body's system better, and with as evolution of science, we have understood cancer better. For now, we know 10 to 15% of cancer have a genetic basis, which means the person is born with an abnormal gene, and which forms cancer later on in life. And many other cancers, especially in India, up to 50% of cancers is due to modifiable risk factors in the form of ill habits like tobacco, smoking, alcohol, or leading an unhealthy lifestyle, lack of exercise, less fiber in diet. So up to almost 50% of cancers can be due to these modifiable risk factors. But however, on the other hand, we still do not know for about 20 to 30% of cancer, we do not have the exact answer why is it caused. Like we have some cancers called sarcomas, which we really don't know the answer why it's caused, which in future, hopefully, research will take us forward and science will tell us to.
Now, the reason why I'm asking this question, of course, use of tobacco and other alcohol substance abuse, they cause to cancer. That has been there in the media for a long time. But probably for the last 10 years, we are listening things like if you use plastic containers, if you are exposed to insecticides, or if you are not using organic food, then it is or even using a microwave. All these things will add to cancer. Is it true? Is there any finding, any research finding on these things?
Right. So the use of PVC or organic compounds or hydrocarbons, they have been established on few cancers like lymphoma and leukemias. But again, it is not a rule which is applicable to all the cancers. Hence, like you say, the general radiation, the microwaves, or even people were worried about telephone radiation from the mobile tower signals. So all that there is
Cell phone, yeah.
unfortunately no concrete proof that they cause cancer. Yeah, they could be as a contributory factor, but we don't have enough data to say to incriminate them as the exact cause of cancer. Yeah, we do have data for concrete data for tobacco to cause cancer and all those, but for these, they are all in the gray area, maybe a contributory factor, but may not be the exact causative factor.
So you mean to say that enough research is not done on this?
Yeah, research is going on. We don't have enough data rather than research is
data.
actually
Okay, fine.
Okay. See, mobiles were introduced only around a couple of decades back. Maybe in another 30 years, we'll know how important is mobile phone radiation. Yes.
Mm-hmm. But this artificial fertilizers were introduced probably some 70, 80 years ago. So we should be able to know if there is any.
Yeah. So the artificial fertilizers, pesticide, they have a role in leukemia and lymphoma and some of the blood cancers, and maybe even this naphthalene compounds in urinary bladder cancer. But again, it does not cover all the cancers. So we do not still know like what do they have causative factor for all the cancers which is known. So some of these
earlier, doctor, you said that
occupational hazards where they are dealing with chemicals on day-to-day basis, like maybe battery industry or cadmium industry. In them, we should encourage proper protective equipment, gloves, masks to prevent their exposure to such chemicals and maybe lead to cancer.
Okay. Doctor, earlier you said that if you can detect cancer in an early stage, it can be treated. But how do we detect cancer? Because a completely healthy person will not walk into a hospital and ask the doctor, can you check whether I have cancer? That's very unlikely. So how do we detect cancer very early?
Yeah, as such, like you say, the symptoms of cancer are not, it's not one symptom fit all. It is like if it's breast cancer, they usually present with a lump in the breast or a lump under the arm in the armpit area. Similarly, if it is cervical cancer, they present with post-menopausal bleeding or post-coital bleeding. So it is not a one symptom which fits all. So what we would like to spread the awareness is that if a person has a strong family history of cancer, which means there is he in his first degree relative, which means his siblings or his parents, there is at least 1 or 2 reported cancers, then there is a strong basis that he or she may get a cancer early. Or in other people, most of us we see are gastric cancers, stomach cancers, and colon cancers. They all initially present with vague symptoms like indigestion, altered bowel habits like alternating constipation or loose motion. So in them, what do we say is do not ignore your symptoms. If you have a symptom which is persisting for more than 2 weeks, then please go consult your doctor immediately and don't just take over-the-counter medication. So that is a way where you can catch it early. So one way is if there is a strong genetic factor, like if you're suspecting where there is a lot of cancers in the family, please go and to a genetic counselor and get screened early. Or if you have a risk factor, like you're working in an industrial area where you're exposed to carcinogens, then please start getting screened early. Or if you have a nagging symptom which does not go away easily for more than 10 to 14 days, again go to your doctor early. So we don't miss it early and we can treat it also well.
Okay. Now, I'm taking a personal example now. My mother died of cancer. She died at the age of 70. She had colon cancer. That's the beginning. My
Right.
grandfather, I haven't seen him. He died at the age of 55, I think. And he also had cancer in his food pipe, esophagus. So I am a candidate where I should be watching out for these symptoms, right?
Yeah, yes. And see, you have, the main, you have only one first degree relative. So it is, you may not be the high risk candidate for cancer. Colon cancer is now we
Hmm.
have screening tools. Like we recommend above the age of 50 years to get at least once in 10 years colonoscopy and every year do something called a blood test in the stool, fecal occult blood test. So we can catch colon cancer
Okay.
early. And there are not many people in our population who are even aware that such screening procedure exists. So our main motto or intention here is to make people aware that even if you have a strong family history, doesn't mean you have to get cancer.
Hmm.
There are some modifiable risk factors through which we can reduce your risk of cancer.
Okay.
And by screening, maybe you can catch it at earlier stage, stage 1, stage 2, or even now we have something called stage 0, which is in situ, which is not yet invasive cancer. So that is
Hmm.
the main purpose of us to spread the awareness.
Okay. Now, cancer starts in one portion of your body, and then we hear that it is being spread all over the body. Now, how does that happen?
Yeah, if I can take this,
Definitely.
yeah.
Yeah, please.
So basically, most cancers, they usually originate from one area or one organ, like a breast
Doctor,
cancer.
if you can look at the camera, it will be good.
Sorry.
Yeah, yeah,
So if
yeah.
it can, most cancers usually originate from one part of the body or one organ of the body, like breast cancer, or it can start from the lung, and through lymphatics and blood, it can spread to other areas in the body or other organs in the body. So these tumor cells can break off from the primary organ where it has started and spread through lymphatics and blood to other areas where it can get deposited and cause secondaries or metastasis there.
Mhm.
So that is how
Now,
basic cancer cells spread.
now I've heard people saying this that if you have cancer and if you go for the option of a surgery, that will increase the chance of spreading of cancer. Now, I never heard anyone from the medical side saying this, but I've heard so many rumors. So I believe that so many people would have heard this. What is your say on this? Is there any
Yeah,
truth in it?
yeah, that is basically it's a very important question. A lot of patients ask us this question when we recommend or when we ask them to go for a biopsy. But this is actually a myth. So doing a biopsy helps us in establishing a diagnosis for cancer, and it does not cause seeding or spread of the cancer from that organ to another organ. So it is actually a myth.
Okay. So there is no need to worry about biopsy, taking a
No need.
sample, or even going for a surgery.
Yes,
Oh,
definitely,
thanks.
definitely. Surgery is a very important component of most solid cancers, and definitely patients should not shy away from the false belief that doing surgery will cause spread of the cancer. It does not. In fact, it
Okay.
is useful. It is important to cure that disease or treat that cancer. Yeah.
Other than surgery, what are the other treatment methods? We heard of
Yeah.
radiation and also some medication. Can you explain on that?
Yes. Yes. Now, before I talk about the cancer therapy as such, I would like to talk a little bit on how do we establish diagnosis that this patient has cancer. For that, we require the radiological test such as scans like ultrasound, X-rays, CT scan, MRIs. This will help us to localize where the cancer is, how big the cancer is. Is it only in one area? Has it spread to other areas, like other distant areas such as the lung, liver, bones? And after that, we need to do a biopsy. That's a pathology test where a sample of tissue is taken from the tumor and looked under the microscope, and the pathologist will confirm whether this is cancer or not. Remember, all swellings, all lumps, or all tumors need not be cancerous. So before we start treatment on this particular patient, we have to find out if it is cancer, and if it is cancer, which type of cancer it is. All lung cancers are not the same. There are different subtypes of lung cancer and in other cancers also. So we need to make sure if it is a cancer.
You said lung cancer, not lung cancer, right? Sorry,
come again?
You said
Yeah.
lump cancer.
Lung. No, not lump.
Not
cancer.
lung cancer, right? Okay.
No, I said lung
Okay.
cancer.
Okay.
Yeah, there are different types of lung cancer. So all lung cancers are not treated in the same way. So before we start the treatment for this particular patient, we need to make sure if it is cancer, and if so, which type of cancer it is, what subtype of cancer it is. So it's very important that we establish the diagnosis of cancer. Like I said, we have to do a biopsy, and also we need to do radiology tests such as CT scan and MRI to see whether the tumor is only in one area or has it gone to different areas. So to stage the tumor, is it only organ confined cancer? Is it spread to the local area, or has it gone to distant areas or metastasis? It is important that we establish the diagnosis of cancer and whether it has spread, and then decide the treatment for cancer. Now, moving to the cancer therapies, that is what
biopsy is the. I have one question. Is biopsy the only test that confirms that it is malignant, it is cancerous?
A tissue diagnosis is very important for us to establish that this is definitely cancer. A sample biopsy is basically nothing but a sample of tissue is removed directly from the tumor or in the area where it has spread. That is, that if the tumor has spread to another area like the liver or to the lung or other areas, then a small amount of tissue can be removed from those areas, looked under the microscope, and it can be confirmed whether it is definitely cancer or not. And only after the confirmation of cancer can we decide on the cancer therapy or the treatment. So that is very important, because in very few instances, other diseases such as tuberculosis, or infections can mimic cancer. So it is very important that a biopsy is done to make sure that this is cancer, and then only can we plan for cancer therapies. Now, moving on to the question that you have asked as to what are the cancer therapies which are available, there are three modalities of treatment for the treatment of cancer. The first one is surgery, where the surgeon removes, or the oncosurgeon, we call them as oncosurgeons. They are doctors who are specialized in cancer surgeries. So here the surgeon will remove the gross tumor that he is able to see. And the second modality of treatment is radiation, which is where radiation therapy is given by radiation oncologist specialist. And the third treatment, or the third modality for the cancer treatment is chemotherapy, where anti-cancer drugs are injected into the patient. It can be given as an infusion, and in some patients it can be given as a tablet form, what we call as an oral form, can be given to the patient. So there are three modalities of treatment: surgery, radiation, and chemotherapy. And in the last 2 decades, there are newer modalities of treatment such as immunotherapy and targeted therapies, which are very specific for that particular tumor. So these are the newer modalities of treatment which has come out in the last few years.
Okay. Now about radiation, surgery, of course, it's removing the cancerous part of the body. Radiation is using X-ray, right?
Yes. Generally, it is the high energy X-rays are focused at the area of the tumor or to the area that the tumor has been removed. So when we talk about radiation therapy, there's a lot of, common people use the word current or, electric treatment,
Okay.
but that is not so. We always tell our patients, we don't, it's not a electrical powerhouse or anything. It is just high energy X-rays which are used to target the tumor, and that is basically what radiation therapy is.
Now, if you have a tumor inside your body, and if you are sending a high energy X-ray,
Yes.
now how will you make sure that it will only damage that part? The
Yes.
rays will be passing through the healthy part of the body.
Yeah.
That part also will get affected, right?
Yeah. So now, when radiation therapy was actually started way back in 1900, so more than 100 years of radiation. I mean, for more than 100 years, radiation therapy has been used for the treatment of cancer. So when they first started using radiation therapy, it was being delivered in very crude methods. They did not have very good machines back then. But over the last 100 plus years, the machine which are used to deliver radiation therapy, and because of sophisticated engineering, we have now come up with machines that are able to target only the area of the tumor and have sparing of the surrounding healthy tissue. So various modalities such as what we call as intensity modulated radiation therapy, image guidance radiation therapy, stereotactic radiation therapy, these are all sophisticated techniques of radiation delivery. We are able to actually give high dose of radiation therapy to the tumor and lower dose to the surrounding healthy tissue.
Now, what about medication, chemotherapy? That is again another subject that there are a lot of superstitions or bad information or wrong information is going around. So what is chemotherapy?
Yes. So chemotherapy is basically, as I mentioned, it is, we will infuse anti-cancer drugs into the patient, which can be given either through a IV line, that is an intravenous line, or we can also now give through a small device, which is what we call as a chemo port, which is inserted under the skin, and chemotherapeutic agents can be infused through that. So, and there are some chemotherapeutic agents that we can give orally also. Now, as I mentioned also, apart from chemotherapy, in the last few years, newer modalities such as immunotherapy and targeted therapies have also come out. And these immunotherapies and targeted therapies are very specific for that particular tumor. So we are able to actually, the patient will actually have lesser side effects than with chemotherapy, but have better tumor response by giving immunotherapy or targeted therapy. May I also ask Dr. Vinu as he's a medical oncologist, and his specialty is basically in chemotherapy and in immunotherapy and targeted therapy. May I request Vinu to just say a few lines?
Yeah. Chemotherapy, the first myth which is chemotherapy is painful. Okay. Chemotherapy is not painful. Chemotherapy is just another injection which is given like an IV infusion, just like a dextrose solution. So chemotherapy, the main principle is it attacks the most rapidly dividing cells in your body. And we know the tumor is the most rapidly dividing cell in the body. But because in our body, we also have normal cells which divide fast, like our hair follicles, like our the mucosa in our mouth, or your bone marrow cells. Hence, you get hair loss, you get some mouth ulcers, and you get low counts or low white blood cells count as a consequence of chemotherapy, which are all manageable side effects, which is coming to the second myth. People say chemotherapy does everlasting damage to your body and the side effects are not manageable. In fact, 90% of chemotherapy side effects are manageable and they are all fully reversible. Patient can go back to a good quality of life as soon as the chemotherapy is over, within a couple of weeks. Okay, so, and we definitely monitor for those side effects which are potentially irreversible, they are very strictly monitored, and we will never allow the chemotherapy dose to go to such an extent to cause irreversible damage. So, and these days you have finer chemotherapies with better formulations, with lesser side effects. And as ma'am said, we have newer biological therapy, which is targeting the biology of the tumor. And of course, the recent last decade has been immunotherapy, which is showing great promise, which is basically allowing your own body's immune system to kill the tumor. So it is definitely the paradigm has shifted, and we have a better, well-equipped chemotherapy with lesser side effects, more potency, and we are seeing much better results.
But those who have taken chemotherapy, I've heard at least a couple of them saying this, that the disease is better. The side effects are worse than the disease.
Yeah, yes.
Now, what do you say about that?
Yeah, in previously the main side effects we used to have was fatigue and vomiting. Vomiting used to be terrible previously. These days, there has been such a development in anti-emetic medicines, or what we say is to prevent vomiting, that we hardly see even 10% of our patients having severe vomiting. The fatigue is a side effect which we are able to control. We are able to manage with good hydration, good nutrition. We can minimize the fatigue to the maximum, and so we are able to minimize the side effects to such an extent that 95% of our patients complete the chemotherapy and they do it pretty fairly comfortably with a good quality of life. So yeah, like you said, sir, it was a major concern, the side effect of chemo, around couple of decades or even before. But as of today, most chemotherapies are, the protocols are designed in such a way to allow for maximal efficacy while minimizing the toxicity.
Okay. Now, X-ray or the radiation will kill the cancerous cells. How does chemotherapy identify the bad cell?
Yeah. So in chemotherapy, again, we have some non-specific chemo and specific chemo. Non-specific chemo is basically intended to kill the cell which divides the fastest. So cancer is supposed to be the cell which is dividing the most rapidly in your body. So that way, the non-specific chemo directly goes and kills the cancer cell preferentially. But then these days we have newer chemotherapy which specifically targets a mutation or a receptor on the tumor cell, and those are very specific chemo. And these days we have moved on to very specific targeted agents which will only attach to the tumor cells with minimum binding to normal cells. So chemotherapy, again, you have different classes. You have non-specific, specific, and these days we have targeted agents, and now the immunotherapy class of of drugs which are helped in combating the cancer.
Now, these days, we also have to ask the cost of this. Is it affordable by people? Chemotherapy.
No, yeah. See, most of the chemotherapy drugs are very well affordable. We have a lot of generic things where a lot of it is being produced in India only. It is very well affordable, and almost under 90% of them are also covered under our insurance schemes, and it is not very expensive. Definitely, the newer targeted agents, the immunotherapies, and as you move on from the first line to the second line, third line, they do get a more expensive. But since these treatments were initiated around a decade back to now, there has been a rapid fall in the price. We feel that as these treatments are offered to more patients and as more patients use it, the cost of production comes down, the reach is increased, and definitely it will become affordable to more people. Initially, when a new treatment is just launched to the market, it is expensive, as it is due to various costs. It is only being produced by one manufacturer, it is patented. But gradually, as more patients reach out, and definitely the cost becomes much less, and it is not that expensive also.
Not
Even
just
today, when we hear, okay, go ahead, doctor.
So I would also just like to add that not just for chemotherapy, but for the treatment, other treatment also, such as surgery and radiation therapy also, the treatment is based on the stage of the cancer. So if it is an early stage of the cancer, only one modality may be required. Maybe just a simple surgery may be required. And if it is locally advanced, or if it is a stage 4 disease, then all the three modalities of treatment, such as surgery, radiation, and chemotherapy, may be required. So all that will add up to the cost of for that particular patient.
Now, see, there are so many reports and so many discussions going on in various media saying that the medical company, the pharmaceutical companies are making money out of it, and a lot of unhealthy practices are going on. So all these things are in the minds of people. So that's why I asked that question.
Yeah, true, sir. Also, we'd like to also mention that even if you are looking for other diseases, not just cancer, even for other diseases, the treatment will be based on what type of surgery they require, or what type of medication they require. Is it going to be a simple treatment, or is it going to be something which is more complicated? Then the cost will go up. So the same way, it's not that cancer alone is an expensive, therapy. All therapies in the field of medicine, whether it is cardiology or nephrology or any, will depend on what is the required treatment for the patient at that point. So you can have simple chemotherapy. So a certain patient may require just a simple chemotherapy where each cycle may cost only about 2,000 to 3,000. Or in another patient, we may have to give up, like who require a targeted therapy. One cycle of chemotherapy may cost maybe even about 50 to 60,000. So it depends on what is the treatment which we have tailored for that particular patient. So there is no one size fits all. There is no blanket rule. So that is what I would just like to emphasize, that many times patient may compare that my treatment is costing lakhs, whereas the next patient's treatment is costing only 50,000. So what I'd like to emphasize and tell the listeners also is that the treatment is not one size fits all. It is basically dependent on what is the treatment that this particular patient requires.
Now, another question that is there in everyone's mind: cancer means, oh yeah, there is no way that I can get out of this. Is there a proper treatment? People can say that they are completely cured of cancer. Is it possible?
Yeah, definitely, sir. The cancers are definitely curable. Especially if you take it again, it depends on what stage it is detected at and what is the biology of the tumor. We have like breast cancers at stage 1 and 2 are curable 80 to 85% of the time. Similarly, even colon cancers, which is the cancer of the intestine, they are also, if they're detected at stage 1 or 2, are curable more than 3/4 of the time. But as they move on to stage 3, they become curable in less than 50% of the patients, and stage 4, very few, less than 5% will become curable. So definitely cancers are curable. And then in the other side, you have the leukemia and lymphomas, where even stage 4 tumors are curable. In leukemia, you have other options like bone marrow transplant, where curability is definitely an option. Hence, it does not just depend on the stage, it also depends on the biology of the tumor. So by increasing awareness and by having more screening procedures, we can detect cancers early on, and it is curable. In fact, in breast, you would have heard, like Angelina Jolie made it very famous when she underwent bilateral mastectomy. She found that she had a gene which could cause cancer because her mother had the same gene and she got cancer. So went ahead, she got it tested, and even before she had cancer, she got both breasts taken off, which is called a prophylactic mastectomy, so that she doesn't get. So in what we are saying is, by just doing a simple screening, breast cancer most patients can be detected at stage 0. Stage 0 is called where the cancer is not yet become invasive. It is called stage 0, and if a proper screening is being done for everyone, up to 30% of cancers can be detected at stage 0. So hence, definitely cancer is a curable disease.
You all already mentioned about the breast cancer and the colon cancer, that you can detect it early. Is there any simple blood test or something where you can detect the presence of cancer in your body?
Yeah. Actually, the research is directed towards that. Recently, in fact, 2 months back, it was in the papers and all over, which made which created a lot of buzz and interest. Some European agency have detected a panel of a blood marker of a panel of around 150-300 genes, where they can claim they can detect cancer around 15 months earlier than it is even picked up on a CT scan. So, and it created a lot of buzz. But however, that is still it is not completely approved by FDA and all the other agencies, and it is just the early research. Definitely in future, like you're saying, we will have a blood panel which detects cancer at the earliest, even before a scan does, and they will definitely come a time. As of today, it is early research.
Now, you mentioned a lot about breast cancer, and a lot of people suffer from breast cancer. But in our country, especially in our society, people are very reluctant to go for a test or medical examination. Is there anything that we can do about it?
Yeah, definitely. See, like I said, in the US, they quote that 1 in 8 women will eventually have breast cancer. And I think it is the same scenario here also. We are seeing a lot of breast cancer, especially even in younger women. So, and like I said, 30% of breast cancer can be detected at stage 0. Stage 0 means it's not even cancerous yet. So, and in them, cure is 99%. So, we have it definitely every woman above age of 45 should at least undergo a screening mammography annually, because mammography picks it up at the earliest stage. We should encourage self breast examination every monthly. We should tell them to visit a doctor every 6 months for a clinical breast examination. And if you have a strong family history of breast or ovarian cancer, which means either siblings or either mother or father has had a history of breast or ovarian cancer at a younger age, they have to come out and get for genetic testing, because 15% of the breast cancers have a genetic basis. So there is definitely, we must encourage more every woman in our country above age of 45 to undergo mammogram, to undergo genetic counseling, and so that the breast cancer can be detected at the earliest stage, and definitely then there is a cure.
So for a simple screening test for breast cancer, what will be the cost, an average?
For screening.
Screening.
So screening is mammogram and ultrasound. And as Dr. Vinu said, above the age of 40, we encourage all women to have an annual mammography done. So the cost for an annual mammography, generally will cost close to about 1,500, and then ultrasound will cost close to 800 rupees. So this is the general plus which I'm giving. Yes.
So 2,500 rupees, you will be able to do this.
Yes, and it is, this mammography is, one test that has saved, hundreds and hundreds of lives in, Western population. And it is definitely proved that it is able to pick up cancer in a very early stage. Mammography is again the use of X-rays to image the breast. It is a simple test. It's an outpatient test. It is basically the imaging of the breast, which is done in two views. That is, one is what we call from top to bottom, craniocaudal, and the other is from side to side, what we call medial lateral view. And using these images, we are able to see very tiny tumors, that is even less than a centimeter. Now, a tumor which is less than a centimeter can be missed out by even the patient when she examines her breast, or even by the doctor when they come to us for a clinical examination. So doing a mammography, we are able to see tumors which are so small, that is even less than a centimeter. And once we see that by using certain scanning, we are able to actually do a biopsy of that small tiny tumor. We are able to look at the biopsy report and say whether it's cancerous or not. So it is definitely a very, very effective screening tool for early detection of cancer.
The reason why I'm asking the cost also is many people don't have this idea that they think that it's a cancer test, so it's going to cost a lot. And then there are people who are working, they don't want to lose that income also, not going to work. But still, it is not a huge amount. If it saves life, definitely.
Yeah, sir, I'd also like to say that we periodically run breast cancer camp, twice a year, sometimes even thrice a year. And, so that is also useful, where during this breast cancer camps, we actually give some, a lower rate for the mammography and for the ultrasound. So patients can actually,
really good.
Public can actually avail of those breast camps and come here during that time for screening.
Oh, that's good. That's a very valuable information. We will let our listeners know about that. Now, what are the other services that Baptist Hospital provide for cancer patients?
Yes, as I already mentioned, we have very good cancer surgeries that are being done. The latest cancer surgeries that are being done in Baptist Hospital. We have doctors who specialize in cancers of various types, Like there are surgeons who operate on head and neck cancers. There are surgeons who operate on abdominal tumors, on gynecological tumors. So all cancer surgeries are being done in Baptist. And apart from that, as I mentioned, we have a state-of-art machine, radiotherapy machine, what is called as a linear accelerator, where we are able to give very focused radiation. I've already spoke to you regarding that, what we call as intensity modulated radiation therapy. So that facility also we have. We have a chemotherapy unit, which has right now about 15 beds. And we give for both adult and for children, we give chemotherapy in that unit. We also give immunotherapy and targeted therapy, which we have been talking about. We have excellent...
So this chemotherapy unit, they need not get admitted. They can come and take the dose and go home. Is it like that?
Most of the chemotherapies are given as daycare. They can come in the morning, and by evening they can get discharged. There are some chemotherapy schedules that need to go for a couple of days, maybe 2 to 3 days. Those patients will be admitted, but majority, I think about 90 to 95% of patients, chemotherapy is given as a daycare. So they need not be admitted overnight. We also have other supportive, departments, such as an excellent radiology department and pathology department. As I mentioned, they help us in diagnosing the cancer for the patients. So we also have in radiology, we have intervention radiology, which is one of the specialty in radiology, where using CT scan and ultrasound, they are able to do CT guided and ultrasound guided procedures for biopsy for the diagnosis of cancer. We also have an excellent palliative care team that helps with pain management for cancer patients and also for supportive management. And when the cancer is far advanced, and when we are looking at an end-of-life care, palliative care team is also very actively involved in the care of the cancer patients. I would also like to say we have hematology services here, where we treat patients with, leukemias and lymphomas. And since the last 1 year, we have opened up our bone marrow transplant unit. And as of now, about 10 patients have been so far received bone marrow transplant. So I would say that all in all, we have a full comprehensive team of cancer care in Baptist Hospital. We also have excellent critical care unit, where when our patients require ICU care, they can be admitted there. And we are the emergency team that is the casualty team, also helps us when our patient comes to the casualty on an emergency basis. And, we have a whole support team to help us in the care for cancer.
Now, talking about palliative care, these are the things that happen in our society. When a person is beyond cure, like the medical science also says that there is nothing can be done. That's the time when some alternative medicine they make some extraordinary claims, like saying that if you would have brought to us, and we would have saved him, things like that. And they also extort money from people. That's a known fact. So then we also have this during the palliative care itself, you administer chemotherapy. Now, if you know that there is no cure, then why you are giving chemotherapy during palliative care? And what about these claims of alternative medicine? You have anything to say on that?
Yes, sir. So actually, palliative chemo means, there are many stage 4 cancers where cure is like less than 5% possibility, like we said. But it doesn't mean that their life. See, we assess a patient based on what is his life expectancy. If we think the patient will not be able to tolerate treatment, his life expectancy is less than 3 months, then more likely we will not offer chemo, and we will send them for best supportive care, which is treating the symptoms, giving a better quality of life, and keeping the pain under check. But there are many cancers where at stage 4, the patient lives for 2 to 3 years or even beyond with chemotherapy, which depends on the biology of disease and the type of cancer. So necessarily stage 4 does not mean always that the patient will succumb to the disease within 6 months or have a bad quality of life. There are many cancers in which stage 4, even though the cure may not be a real possibility, but they can live with the cancer with a good quality of life on treatment for good couple of years or even more. Hence, these are the patients we carefully select who are in good condition, whom we give chemo, and when the chemo acts and the tumor shrinks, they can have a very good quality of life for a year, 2 years, or even beyond, which we see in many patients. And this is the term we use, palliative chemo, which may sometimes be misleading because it's really not palliative, but actually enables them to lead a good life. Alternative medicine is an interesting thing because many of our chemo are derived from plant alkaloids, from microbial source like bacteria. So many of our chemo have a environmental or an organic origin. So we do not know how well the Ayurvedic products work. We don't know because first it's not our specialty and we don't have enough data on that. They could possibly well work. We do not know because many of our chemotherapy have a background of from a plant alkaloid, like I said, or a plant resin or a microbial source. So that is, yeah, and we are not trained in that. So we may not be able to tell you enough about that, sir.
Okay. Yeah, thank you so much for spending time with us, with our audience. I believe that it was very informative. Personally, I was able to get clarified so many doubts that I have. So thank you so much. And I also want to appreciate you both for taking time off from your busy schedule to spend time with us. We also want to appreciate your contribution to mankind, especially during this COVID period that you were putting your life, your health at risk in treating people. I'm sure that our audience are also with me when I say that we are grateful to your profession and we really appreciate what you've been doing. Thank you so much.
Thank you so much. So again, I would also just like to emphasize to our audience, let us do our part to raise awareness about cancer and talk to our dear ones, our friends, our colleagues, our family members about the need for screening for cancer. And if cancer can be detected at an early stage, there is a high chance of cure. So it is very important that all of us do our part. It is not just the health workers, that is the nurses or the doctors, who should do their part in raising awareness about cancer, but all of us have a role. All of us have to contribute to our loved ones, to our community in raising awareness about breast cancer. So let us all hold hands and decide that we will do our bit in raising awareness about cancer. Thank you all so much.
Thank you. That was Dr. Saro Jacob, consultant radiation oncologist, head of the Department of Oncology and Hematology Service in Baptist Hospital, Bangalore, and also Dr. Vinu Sarathi, consultant medical oncologist. Thank you so much for joining us.
Thank you.